anybody coming? Is Matt coming down here? Huh?
Okay.
All right, let's go ahead.
No rousting out.
Okay. You don't count.
Awkward silence.
Okay. Go ahead and get started.
Good morning. Thank you for the opportunity to present our 24-25 budget request to all of you. Appreciate the past support. We've had a great year. We look forward to another great year in fiscal year 25. Our estimated revenue for the proposed fiscal year will be a little over $1.1 million, and our requested expenditures would be just a hair over that at $1.124 million. Our current FTEs remain at 7 for the proposed fiscal year. About $9,000 in the additional expenses, those related to scheduled personnel expenditures, insurance increases, et cetera. There is a slight increase in the expected hazmat cost. There is a countywide agreement between the Board of Supervisors and the City of Des Moines for countywide hazmat services, and that continues to inch up year over year related to, I think, probably what you would expect: supply costs increase, personnel increases, insurance increases for the City of Des Moines Fire Department. Our base wage and step merit increases would account for about $4,000 of increase. Our recent accomplishments, we'll go through this list, so I won't pause here unless there.
AJ, can I stop here for just a second? And I don't want to spend a ton of time on this, so bear with me, but you can probably even talk to me about it later if you want to. But, and Angela, maybe other board members remember, but, you know, we had this discussion about hazmat years ago, fairly lengthy debate about why it was just Des Moines and Polk County that were providing the services, and all the other jurisdictions that hazmat could actually respond to, whether it be Johnson, Urban, whoever it may be. Are they participating at all financially in hazmat yet?
No, not directly. The contract is entirely covered by the Board of Supervisors and through your budget.
Okay. That's helpful. Thank you. Thank you, sir. May I have another?
I'm sorry, that's the most direct answer.
Okay.
That's a discussion
All
for
right.
another
Okay.
day.
All right.
Nobody
Thank you.
wants that one, is there?
No, okay.
I do recall on the stamp on the contract that I have seen goes back to the mid-'80s.
It's been a long time, and we've had that discussion,
Yeah,
remember,
we
a long
had, I
time
know,
ago.
and I can't remember how it all ended up. We just
It
walked
went
away from
south.
it and went, we stopped because nobody wanted to.
We didn't want to tackle it.
No.
Well, anytime you want to,
Any
I'm
board,
ready.
any board members want to volunteer to take that on? Okay.
Act on any direction you give us.
All right, thanks, that's good.
So by the numbers, this would be our responses, primarily through our duty officer. There are some multi-day activations of our Emergency Operations Center, but for the most part, you're seeing the majority of our emergency responses related to single-family and multifamily fires, where the survivors needed assistance in finding a place to go, maybe some food and clothing, and of course work with our partners, the fire departments, Red Cross, Salvation Army, Community Family Youth Services, and the list goes on. But that would account for the vast majority of our responses. You can see the balance there. Some hazmat. Special events continue to take up a great deal of our time. I don't say that in a bad way. They are an excellent way to engage in our community partners, support these major events like RAGBRAI and Ironman. So we, again, are prepared to support a number of great events that the county and the cities bring in to the metro area. Some utility disruptions, of course, the extreme temperature, 3 of those in 2023, and as you all are very aware, we're off to a fast start with extreme temperatures this year as well. A couple dive team requests, some severe weather, multi-day operations, a couple evacuations, and then kind of a hodgepodge of miscellaneous responses that would be things like a car running into a house and those kinds of things. 2023 was, that number since this was published has actually gone up to 118, so we're just statistically one response less than we were in 2022. As I mentioned, the planned events include RAGBRAI, the State Fair. The picture in the lower middle is after our after-action review from the RAGBRAI, that's the planning and EOC team. You can see state, local entities, nonprofit organizations, private sector, National Weather Service, so and most everybody I think is smiling in the picture, so this is after it was over, but I think a tremendous showing of the community coming together. We had 9 geographic divisions, which would relate to the 9 jurisdictions, including the county and several segments of the county, and then a handful of cities as well. So all great positive things to say, and if you probably remember, it was on one of the hottest days of the year, and we really, the entire team did a magnificent job. And I'll just highlight, on the bottom right, that's my daughter. She brought me coffee that morning, so it was a great way to start the day. On the mass casualty incident plan, was significantly updated along with a revamp of the training, so working with Central Iowa EMS directors. The extreme temperature plan, Mr. Geisinger, our deputy director here behind me, led a group to coordinate with the Homeless Coordinating Council and many others. And every time we go through it, we learn more. And so we expect here in the next couple weeks to bring that leadership team back together based on this latest experience that we've had in making the adjustments that the team would recommend. We conducted several lunch and learn sessions on a variety of topics, as well as a significant reunification exercise related to active threat involving the schools and the AEA. And tragically, those experiences were put to use with the Perry incident. Very excited to have Laura Kaser on board. She is our resiliency coordinator. We appreciate the support and leadership and vision that you all as the Board of Supervisors have shown, leveraging our experience from COVID. Laura will do a great job. She's off to a great start on mitigation plan and recovery planning and the countywide healthcare coalition. So a lot of great things have already started, and we expect a lot more to happen in the months and years to come. That last major bullet point on the Polk County Healthcare Coalition and Medical Coordination Center, work that was started under the leadership of Helen Eddy and Franny Medeiros with the health department. We continue to work very, very closely with them. We're fortunate to be in the same building, as you're aware, and so a lot of cross-departmental efforts that are taking place there. CAD to CAD project, again, recognize Deputy Director Geisinger on this, but there's dozens and dozens of others that have been involved with the local public safety answering points or 911 centers, technical experts, operators, leaders within communications and technology to connect our computer-aided dispatch systems between the city of Des Moines, Polk County, and Westcom. There are a number of advantages to our first responders. Those on the street will see the benefits directly by being able to do closest unit response, and many communities are already starting to take advantage of those capabilities provided through the CAD to CAD project. We finished with the assistance of the 911 Service Board, Emergency Management Commission, and a firm called Forbes that finished a financial procedures review. This assisted the Emergency Management Commission in considering a request from the 911 Service Board to take over the fiscal agency responsibility from the 911 Service Board. The 911 coordinator works in the Emergency Management Agency, so I think this is a natural transition, and all 3 PSAPs were provided and accepted the ending fund balances as of end of fiscal year 2023. And so we were able to then use those numbers to update fiscal year 24. And so the proposed fiscal year 25 budget for the 911 Service Board has been presented, as Supervisor Brownell is very aware, to the 911 Service Board's Executive Committee a couple weeks ago, and they will consider that budget for adoption, public hearing, and eventual adoption on February 21st. Other accomplishments I'd like to highlight, if I could, would be just the overall relationships amongst the public safety and what we call first and second responders. We had a great summer. Appreciate the county's support of the summer employment program. That benefits us greatly. When we can go from 6 to 7 or 7 to 8 employees, that's a percentage-wise a pretty big boost for us. So we appreciate that. The great news there is that we had one unpaid intern as well as a summer employee. Brody Malone was the summer employee hired under the county's program, and he has now gone on to become the Howard County Emergency Management Director. So great success there. Anthony Coleman has been accepted recently by the Des Moines Fire Department into their academy, so they're both off to a great start in their young careers. Also great news, working directly with the Iowa Event Center, received a grant for $375,000 to improve the detection equipment for the entire event center, Hy-Vee Hall, as well as Wells Fargo. So great team to work with up there, and again, an application drafted by Dutch and accepted by the state to use some federal dollars for security enhancements and detection equipment. Also good news on security assessments with schools. They had a requirement to complete an assessment prior to applying for the school security, the governor's school security program. And so many schools could not conduct that, did not have the internal expertise to conduct those security assessments, and our agency assisted them in doing that, completing that, which allowed them then to apply to receive, I think, $50,000 per building for each of the school.
How did that work out? I mean, how many schools needed that? And how many of them were Des Moines? I'm just curious.
All of the schools that wanted to apply to receive equipment and supplies would require the assessment. I believe that our office assisted 9 schools.
Okay.
Most of them were the Des Moines Diocese parochial schools.
Okay.
Too, on the adjacents, we learned from the sheriff's proposal the lack of connectivity to the inside of buildings. Was that part of the security assessments at all?
I apologize, I'll have to defer to Dutch on that.
I missed the question, so what was it?
Well, the lack of, is it radio access?
Yes,
From
well,
the interiors of school buildings, lack connectivity?
Dead
Okay.
zones.
Penetration.
Absolutely, that was a big part of it. They tried to overcome that by issuing each school district a radio, interrupt radio, communicate directly with their PSATs. That was part of the assessment, was ability to communicate within the school buildings themselves. There were a lot of dead spots, so to speak, where a radio just couldn't get out. So it's really up to the schools on how they can use the funding, but that was part of the overall assessment.
I want to follow up with the sheriff, see that chart they gave us of the school buildings that lacked connectivity. We'll have to get probably all of us together. I don't know if you heard the conversation we had with them about possibly doing a grant program. Yeah. What's that?
Yeah, video part of this
Oh,
too?
sorry.
Yes, video is included. Anything that's considered a physical security feature, locks, guns, doors, keys, all of that stuff is part of the consideration on doing bringing school resource officers. All of that's included in the assessment process.
Yeah, we may want to get everyone together and figure out how to,
Yeah, we'd be happy to participate in any
Input in that.
follow-up conversations on that.
yeah.
Do we know if the sheriff based his budget ask on this assessment?
That's what I don't know.
I don't think so.
Proposal was just for the clients he's serving, which would be North Polk,
Right.
Bondurant,
Right. Oh,
Councilor
okay.
Grimes, so.
Oh, I see.
Number
Yeah,
one
that's
schools
right,
would be
that's
kind
right.
of not part of that arrangement at all.
Yeah,
Yeah.
okay.
Okay.
So looking at the upcoming calendar year, which obviously doesn't completely align with the budget, fiscal year budget, but just to give you a sense of what we expect in calendar year 2024 was to continue our active threat comprehensive training and exercise program. We're working very closely with Prairie Meadows. Prairie Meadows has offered their back areas, the paddocks and dorms and other spaces when it's not being used during race activities to utilize for exercises and training. So again, great partnership with Prairie Meadow. Appreciate their generosity, and that will align well with a countywide, even metro-wide, really, beyond Polk County borders with law enforcement, fire, EMS, communications, probably leaving out a couple other partners in that. Sort of alongside that same process will be to develop a regional training consortium or collaborative. We haven't nailed down the right descriptive there, but basically it's training officers from police, fire, EMS, and other agencies across the metro to come together to share training so that our training leverages multi-jurisdictional and multidisciplinary training whenever possible. Talked a little bit about the CAD to CAD project, computer-aided dispatch improvements. Moving from what's called awareness into unify. This is going from basically having to go and look for information that's available to be able to have information be presented to the dispatchers of closest units across PSAP boundaries. So Des Moines can see what Westcom has, Westcom can see what Polk County has, et cetera. Again, it enhances the safety of officers on the street to be able to not have to go through 6 manual steps to be able to interoperate with their neighbors, which may be just across, a couple blocks away, but be on a different communication system. So that's, we could go on and on about the improvements that are possible there, but well on our way to unify status. I believe sometime in February that they're going to go live with that. Excuse me. Talked about the financial procedures review and how that enables a transition that's being considered right now between the 911 Service Board and the Emergency Management Commission for fiscal agency responsibility. Talked about Laura Kaser's activities and how what she's going to do will have a great positive impact on the Medical Coordination Center and the county-focused healthcare coalition. Our county hazard mitigation plan, we're about halfway through that update. We expect that update to be completed in June of 2024. That enables all jurisdictions that are participating, all the cities, the county, school districts, to apply for hazard mitigation grant projects. Those projects, since 2004, have produced a return on investment of over $35 million. And I think that that's way underestimating that amount. But if you think about stormwater retention, stormwater management activities alone, the cities and the county have done a magnificent job of leveraging projects identified in that plan to apply for federal and state dollars to reduce or eliminate hazard risks across Polk County. Our damage assessment process is somewhat dictated by the state. We have to be able to submit our damage assessment information in a way that's consistent with other counties across the state so that the state can roll that up and ask from a state level to FEMA Region 7 for a disaster declaration. So we're a little bit right now just kind of treading water, waiting for the state to tell us what exactly their process is. If something happened today or tomorrow, we'd still move forward with a damage assessment process. It just may be a little bit more cumbersome, not knowing what exactly the state's going to land on for software applications and those kind of things. But we're waiting for their lead, but can certainly do it if we had to, like we have done it the past several years. We expect to receive requests from the state fair, and there'll be another Ironman, as you're aware of. taking place, and there'll be additional planned events that I'm sure we're asked to participate and support, and we look forward to doing that. On the training side, we will have several EOC, Emergency Operations Center, what we call short courses. This is a way to make sure that everyone's skills and abilities are on point, so that we don't have somebody that walks into the EOC during a disaster and that be their first time there and not understand what they're expected to do. So in the past, we've done a 3-day sort of intensive course, and that's just not practical to expect people to spend 3 full days just focused on that. So we're going to break that up into smaller, like a 2 or 3 hour chunk, and do that monthly or quarterly, and deliver that training in that environment, as well as our planned event. We have a lot of the cities that have seen the success we've had of planning for and managing Ironman and RAGBRAI, and some of these communities have asked, could you provide some training for their staff? A specific example would be Ankeny with Summerfest. We'll be working with the police and fire department next week on facilitating a planning process that they can leverage for being better prepared for Summerfest, and that's just one example. We have a significant undertaking for the recovery plan over the next 4.5 years, actually. The economic portion of that recovery plan has been completed. I think we would all admit that it's a good placeholder, but that we need a lot more engagement, involvement from experts in those areas, not just the economy, but as we move forward into health, social, infrastructure, housing, and cultural and natural environments. It's so important that they're involved, and we can facilitate that, but we're certainly not subject matter experts in those areas. But we'll be doing our outreach and encouraging them to be involved, so that we're developing a recovery plan when the skies are blue, rather than under the stress and emotions of the time immediately after a disaster. With the exception of the strategic plan, which we are constantly kind of chipping away at, I would describe it as. I think everything else there I've already covered. So with that, I will end by acknowledging and thanking the entire team that we have. They do great work, selfless, dedicated, so really appreciate their friendship and as well as their hard work. And in closing, just wonderful to work for all of you and the support that you've provided over the years. And without that, everything we've talked about would not be possible. So thank you, and I'd be happy to answer any questions.
AJ, the board might want to be briefed a little bit on, and I want to preface by saying I think our response to the Perry High School was very good overall. Not just yours, but the entire Metro's response is very good. So there wasn't a lot of failures there, and I know you're going to have a debriefing on that soon. But what are some of the things that maybe we could improve upon that you saw? I'm thinking CMed for one thing, and there was also a Dallas County kind of interface with communications that maybe didn't work so well. Could you kind of cover some of that for the board?
Yeah, overall, I agree with you, sir, that the response was as good as it could be given those circumstances. Specifically, you mentioned CMed. That is a radio system that connects our dispatch centers to the hospitals, which we're able to provide immediate notification to the hospitals, and we can get bed counts and other information about, patients leaving the scene and arriving at a hospital, and making sure that we are connecting the dots, that we know every patient that's left the scene and where they're at and when they've arrived. That system failed, and so we overcame it with a lot of phone calls and personnel just doing hard work. And that medical coordination center that was established under COVID was put to use during the Perry response. And working with Central Iowa EMS directors, Polk County Health Department, Sheriff's Dispatch, Polk County Sheriff's Dispatch. If you're not aware, the calls that would have come directly to Dallas County Dispatch, those phone lines immediately are busy, jammed up by calls, and they rolled over to Polk County Dispatch. And so our dispatchers did an outstanding job of getting those first phone calls and trying to wrap their head around that they're getting phone calls from Perry about that incident. They quickly understood that there was the phone rollover and then immediately started to attempted to notify the hospitals using that CMed system. And quite frankly, the hospitals have multiple radios that they're listening to, and some have that turned down. So we're trying to figure out a better way to integrate so that dispatchers at the hospitals don't have to physically switch to something else. And so I think we have a great solution in mind. It's just a matter of some programming. Their Iowa Department of Public Health, I guess Health and Human Services now, plays a role in that because they own the license to the CMed radio system. So there are a few steps to overcome, but I think it's possible, and hopefully within 6 months that we have that particular problem fixed. But on balance, people just did what they needed to do to overcome those kind of systems, and that particular radio system failed, but the people figured out a way to still do the
Well, on a
get the
day-to-day basis,
information.
I think what happens is they don't use CMed, the ambulance wouldn't use CMed, for example, going from point A to point B, they just use a cell phone, which is fine on a day-to-day basis, but you get an emergency like that, it doesn't work so well.
Absolutely.
So that's a problem. There was also a problem with the Westcom got cut out of the communication piece, didn't they, somehow?
Yeah, there continues to be the use of what are called patches, and a system called Rhino that had its application but should not have to be depended upon in a situation like this. So we have a Metro Interop meeting tomorrow at 11 o'clock, and all of those are on the agenda for discussion, particularly to the use of patches. The Polk County Sheriff's Office and the City of Des Moines have done some radio programming that doesn't Polk County and the City of Des Moines have done the radio programming to include all of the regional and statewide talk groups to be utilized in a situation like Perry. Westcom has not made those same radio program changes to date, and so we'll be talking more about that tomorrow at 11.
Thanks.
Any other questions for him? Great job, thank you.
Thank you, everybody.
Okay, thank you. I'll pass them. Thank you.
Want me to go ahead and get going?
Oh,
Or
I'm sorry,
wait for-
yes. No, go for it.
Okay. Well, good morning. Appreciate the opportunity to present the Human Resources Department's budget request. First, I'd just like to thank you for your support throughout the year and the resources and support you provide. My team really appreciate it. It enables all of the programming, all of the benefits, wages, events, everything that we assist with and serve other departments and the employees of Polk County. It enables it all to happen, so we really appreciate all the support. So I'll jump right in. Estimated revenue, you've heard me indicate this in the past, just hit it real quick. This is subrogation revenue as part of our risk management program. Somebody, causes damage, a third party causes damage to county property. We pursue that, right? We pursue a reimbursement from those folks for costs that we front to fix whatever it is. So those are reimbursements that we pursue through subrogation. Requested expenditures or expense, 9.669 million with 17.9 FTEs, and we'll discuss the $380,000 over target, which, going to the next slide, the expense increase compared to current budget is 19,000. Those changes are obviously detailed in the documents you have and highlighted here with $167,000 in wages and benefit costs. I'll cover the one-time appropriation for the Wellness Initiatives Pilot Program, which I'd like to continue, and that's part of my decision packages on the following slide, and I'll explain that in more detail in just a moment. But we have the one-time adjustment for the class and comp study, some adjustments to just my review of the budget, and trend would be those other defense expense adjustments and miscellaneous adjustments. For decision packages, so continuation of the wellness initiatives, this breaks down into two categories. The first one is $200,000 for our early intervention physical therapy program. We're just getting that off the floor. We've had some delays in the RFP and contracting process, wanted to get it closer to the beginning of this fiscal, didn't happen, but we have it in place right now. It's gonna be up and running February 1. But essentially, what that program does, it provides physical therapy services to our employees. Athletico is our partner in this, so that's who was selected. They'll come on site even to provide early intervention is what it's for. It's to address musculoskeletal injuries, hopefully before they become serious, strains that would become rips or tears, strengthening muscles so we avoid, back herniated discs, things like that, things that are expensive medical procedures, right? Whether it's in the work comp context or whether it's medical plan context. These types of programs have been shown to reduce overall work comp and medical plan spend, but that's why we're kind of, pursuing this as a pilot program, because we want to see what that experience is and whether it is as it's been, as the data has shown for other organizations. I'd like to continue that. Obviously, the spend for this year, you appropriated $200,000 for this fiscal. We're going to be obviously well under that because we're getting a later start. So it'll kind of be spread half this year, half next year. I believe we'll be under that $200,000 mark for the overall spend over the next year. We'll see what that experience is. I'll have more information for you when I'm back here next year to be able to tell you what that experience is and if we're seeing planned savings and if that program is proving successful. So we believe it will be based upon the data we've been presented.
Does the employee just pay the copay for this?
No, this is a direct access free program for our employees. Yeah, so that's one of the barriers, right, to going to seek services, making an appointment at a PT provider, or getting a script for PT through their primary care provider. All of the hurdles that you have to go through to access the care. If I have a strain or some issue I'm dealing with, some ailment that could become serious, we want to make it as easy on these employees as possible, so they can even make appointments, for on-site care. We're going to be working with especially those classifications and departments that have physically demanding positions, so we can get folks on site and have some of those appointments be direct care in that regard. So, the hope is, in experience with other large employers that Athletico specifically has had, is a pretty significant reduction in the work comp and medical plan spend as related to medical musculoskeletal conditions especially.
Wow. Okay, let's hope it works.
But yep, I'll have a report back for you next budget hearing on that. So the other $70,000 is health gauge preventative screening, stroke prevention. This was an incredible success in my opinion. I'll talk a little bit more about it in our recent accomplishments, but I'm proposing this allocation of $70,000. We spent actually closer to $35,000. The $70,000 was earmarked for if all folks eligible to participate would have. About half of the folks eligible to participated. We're hoping each year to increase that. But that program was a great success, and I'll talk a little bit more about that in just a moment. But just to hit on the other two decision package items, the risk management expenses, $2,000, that's related to cell phones for our claims analysts, so they wouldn't have to use their personal cell phones for after-hours calls. And then the Project Iowa internships. I gave you a handout. I know that's been discussed in prior budget hearings with the recorder, treasurer, county attorney yesterday as well, I believe. We have been in contact with and coordinating, Lexi has, with the program director for that program. We think obviously, it's shown to be successful with IT, and this would be an allocation of 6 interns at $18,000 an intern for that 9-month program. So we have, I think Helen just emailed me about some interest with the health department this morning too. So I think there's definitely interest. We'll fill those 6 positions with interns as we're working with the folks at Project Iowa and the Youth Works program, and hopefully it'll be a great success. So that's what the $108,000 is.
So let me get this straight. The recorder comes in and wants, say, an intern, but she had it on her budget. So we would say, no, she wouldn't have to worry about that in the budget because you'd be picking that up, right?
Correct.
Okay.
Yep, it all flows through our budget, kind of like the summer program does.
Right,
Yeah,
okay.
it'll all flow through our program. We'll pay it and coordinate and place them.
Makes sense. Good, thanks.
You bet. And just one other note, we're also, as far as, programs with high school students, we're also in coordination, just started conversations with IWD on work-based learning program that they have. They've been focused more on private sector employers, so we're kind of dipping our toe in the waters with them to see if there are any connections that we can make and resources that they have available to us to connect maybe some of our department work, especially in maybe the clerical or administrative area, with the programs that they have through IWD and their work-based learning program. So I may have some more information with that in the coming months as we learn more about what collaboration we could have there. Sarah connected us with those folks, and we're hopeful that that'll be a good collaboration, good network for us there as well. So some recent accomplishments. This is from our, I just excerpted this from our department highlight that we had in the Polk Future article. So you may have already seen some of these, but a couple things I just want to highlight. We held our first employee benefits fair back in October. Over 200 of our employees came and were able to sit through some presentations from our benefit providers, learn more about their benefits, those sorts of things. I thought we had a lot of great feedback on it from departments, department leadership. We're trying to figure out ways and how to, connect with all of our employees. It's difficult for some, especially some of the 24/7, right, and making sure they have access to some of this too. But it was a great success, and we're planning to do that again. I mentioned the health gauge wellness screenings, the stroke prevention screenings. We had 230 employees participate in that, finding 29 abnormalities that were referred for immediate attention to their care provider. We can't really capture the, obviously, the savings that we may experience because we identified somebody who may have a stroke tomorrow or next week or next month. But obviously, that can be huge savings in those medical costs, and obviously just to the person themselves, right? And making sure that they're healthy, and then addressing the issues that they have, and not obviously missing work then too. So in the DEI area, obviously Keisha is doing an outstanding job putting on lunch and learns. If you've attended those, they've been wonderful, very engaging. We've hosted a variety of other events, the Welcoming Week, and then we did a belonging survey for all departments, and Keisha has been meeting with department leadership on what those survey results have indicated. So we think that's been a great success. Just a couple items on recruitment and retention. Just so you kind of get a sense, we processed in 2023, as of the time I was creating this slide deck, about 4,200 applications for around 203 positions that were posted in 2023. So that's a fairly big number, and that's the majority of that runs through Lexi. So she's doing a great job there. And then also in the risk management area, I'd like to highlight, I think this is really, I mentioned this last year, the savings we've experienced through our third-party medical bill review provider, who negotiates discounts and reviews our bills, and we get the benefit of those discounts. And we entered into a contract with them in 2022 through a competitive bidding process that we hadn't probably done as timely as we should have, which speaks to the need to make sure everyone's doing RFPs timely and going back out to market, making sure that our contracts are competitive. But since May of 2022, the county has saved through the discount program about $520,000 since that time. So that's been a great success for our risk management team. Couple items we have coming up in the near term. We have obviously the full implementation of the early intervention program with our partner Athletico. This year we'll have some benefits RFPs that Lola will be working on for both our deferred compensation and medical plan. We'll have some strategic implementation of the class comp study recommendations that we're still working with our consultant on and finalizing those, and we'll be working with John in the budget office, so you will have much more information and much more detail on that as we kind of finalize that information. And also we plan to have some policy and handbook and manual updates that are needed for 2024 as well. Some long-term goals that we're looking at, obviously there are some budgetary outlook, especially for 25, 26 is challenging, right? So we're looking for different ways that we can possibly provide, employee different types of benefits through the self-insurance program, which is obviously funded through the supplemental fund, and looking for ways that we can kind of strategically plan for that, in the event the 25, 26 budget is such that wage increases aren't maybe what historically we've been able to provide. With that, I'd just like to, as a kind of a last note, Blair Parker's here, my deputy director. She and the team in HR have done an outstanding job. They do a lot in serving the departments and offices and the employees of Polk County, so they just like to recognize their efforts as well. They do an outstanding job. So with that, any questions?
Anybody have any questions for HR? Well, I think the wellness program and everything else that you do certainly serves us well and our employees, so I appreciate that. I'll be anxious to see how this Athletico goes. It certainly makes sense if you get on top of things first before it goes to hell in a handbasket, and then, you gotta have surgery or be out for a while or whatever, so.
Right.
On the surface, it makes sense.
Right, and one thing we're really excited about, it does have a training component as well to make sure we have people understanding, some of the things that they should be doing physically and stretching and exercise, but, the things that Drew pushes all the time.
Yeah, I've
But-
heard that.
But, yeah, we're hopeful that'll be, it'll be another tool in our toolbox.
I think
Yeah.
what's cool about it is you removed all these hurdles. Normally you'd have to get a script and then, jump through these hoops and everything to get that kind
Right.
of care. You can just do it now, so
Right.
that's very cool.
Yep,
Does the employee just call?
yep. They'll
Doesn't have to go through you?
call directly with Athletico, they'll make the
Call 'em
appointments.
today.
We'll have
I got
office
pain.
hour, yep, we'll have it all. I can, if you'd like, I can have Drew, do a presentation, to you all as well, if you're very, more interested in the program. Drew's coordinating with Athletico, he's our point person on it. Really excited about the program and all its features and hoping it plays out exactly as Athletico has said it has, and they've experienced with other employers.
That'd be good.
It's just a little off topic, I guess. I wanted to, if we're done here with the human resources piece, I wanted to revisit the hazmat thing that Tom brought up. We've dealt with that a couple of times. since I've
Thank
been
you,
here.
Jeff.
Yeah, thanks, Jeff. Great job. We've dealt with that a couple times since I've been down here, and it seems to me, I'm trying to put this together in my mind, why we didn't do anything about it. And I'm thinking it works like this, if I remember correctly. ABC Transportation has a huge fuel spill somewhere. Costs $50,000 for hazmat to go out and clean it up. ABC Transportation gets billed for it. If they won't pay or don't pay all of it, that's where we come in. We make up the gap, or we pay it if they don't pay. I think we found that most of the people that were billing were paying, so it turned out not to be that big a deal. And it was now, the exposure's millions, of course, but if nobody paid at all ever, but they do tend to pay. And so it was the exposure was maybe, I don't remember, it's six figures. I don't remember if it was 100,000 or 800,000 what it was, but it's something to look at. Because maybe it's changed. It's been several years since we looked at it last. But the last time we looked at it, it wasn't that big a deal. It probably wouldn't be worth all the effort to get it fixed with all these different communities, because it wasn't that much money. Most of the people we're billing were paying, so not that big a thing. But
I think
interested
you're
to know
right.
what it is now.
The corporations and the big spills, people are paying. It's
Yeah.
accidents that happen, that maybe a car runs into a, you know, a van or something and hazmat gets
Right,
called out,
Right,
nobody pays those.
Right.
So they bill us. But those other big spills, they get paid.
right.
So I don't think it's a lot.
And then there was the aspect of, do you really need to dispatch hazmat for a car wreck?
Right.
And that's kind of the issues, you know, that were kind of
Right.
tangential to this whole thing.
Right. We've got one more presentation, that Cahill's gonna do. Is he back here? John, come on out. I know you can hear us. Yeah, they're gonna come out and show us the name of the, building at 19 Carpenter. And what it looks like when you put it on logo and